So hand, foot, and mouth disease is a tough virus that impacts lots of children and adults, and you need to be aware of it, particularly if your kid is in childcare or in some sort of home daycare. So the obvious or pathologic findings that confirm the diagnosis is blisters on the hand, on the feet, and around the mouth. And so those are viral vesicles, meaning crusty blisters that happen in those different areas, but it's not happening right away. So the stages of hand, foot, and mouth disease, it usually starts out as a cold or a flu-like illness, so mild fever, sore throat, runny nose, stomach, and loss of appetite. And so that can be almost any cold or virus that your child may have. And then they develop this itchy rash on the soles of their feet, on their hands, elbows, knees, even down in their diaper area, as well as these painful mouth sores that may cause them to not want to eat as much and get dehydrated. They can also have some really swollen lymph nodes. So it is very contagious. So it's spread through the air, so airborne droplets, touching or coming in contact with saliva or stool, so changing diapers, that kind of thing, kissing, hugging, sharing eating utensils, or touching contaminated toys. So again, once it gets into daycare, it goes through everything. So complications can include dehydration. We already talked about that. The mouth sores are really painful. And again, because this is a viral illness, it's just going to take time. Your nails can fall off, so you can lose your fingernails or your toenails. And then very uncommon is viral meningitis. And that's good because that is severe inflammation of the lining of your brain. The good news is that it goes away after a week or 10 days. You just need to make sure that your child has plenty of fluids, using Tylenol and Motrin for pain. And obviously, if they have changes in their mental health status or they look really dehydrated, you need to take them to the emergency room. The other thing you need to be aware of is you can get it too, and having it as an adult is not so much fun. I'm Dr. Stephen Goudy, pediatric ear, nose, and throat surgeon and inventor of the NoseBot, hopefully providing you some helpful tips if you encounter hand, foot, and mouth disease in your family.